is Nick Binney, and I'm a therapist here at the Andrews Center. What you're about to see is a part of a series of videos that I'm doing where I interview different staff here in order to learn and show what it is that we do at the Andrews Center. We have a lot of wonderful, dedicated people working here, and I'm excited for you to be introduced to some of them. These videos can be used by clients, by staff, by community members, really anyone that is interested in learning more about the different ways that we try to serve our community. I hope you enjoy this video, and please see the other videos in this series to learn more. Thank you.
My name is Dominique Guthrie. I'm the program manager for the HOPE program at the Andrews Center. We have a few different names: the HOPE program, the FEP program, and even the CSC program. But if you hear those, they are all the same program.
Okay. And FEP, that is First Episode Psychosis, correct?
Yes, that is correct. First Episode of Psychosis. CSC stands for Coordinated Specialty Care, and HOPE stands for Helping Other People Exceed.
Okay. So thinking about the psychosis thing, it sounds like this is a program targeted towards clients with some sort of schizophrenia-related illness. So if you could tell us a bit about that.
Yes, our program specializes in helping those ages 15 to 30 who are experiencing the first episode of psychosis. So it does not necessarily have to be a diagnosis of schizophrenia, but it could be psychosis as a whole, whether that's visual, auditory, tactile, or paranoid thinking, thinking that would be out of the norm. I would say all of those things that would fall under psychosis would make someone eligible for our program.
Okay. So 15 to 30, this has to be the first time that I've experienced some sort of hallucination or delusion, correct?
Yes, that is correct, within the last 2 years. So let's say your psychosis began not last week or so, but let's say for the first time, let's say in January, you had your first episode of psychosis. Maybe you went into other types of treatment, or maybe went into case management or something of that sort. You can still join our program because your first episode of psychosis was recent enough to be eligible for our program. So if it has been within the last 2 years, you can still join all the same.
Perfect. And I don't necessarily have to have that schizophrenia, schizoaffective disorder diagnosis label, just having to experience the hallucinations or delusions within the last correct. 1 to 2 years.
Yes, that is correct. And as long as those, the only exclusionary points that we have, as long as those are not drug induced, you would be able to enter. Many times people have experiences with different substances and they experience psychosis, which would be primarily when they're using that substance or after effects. You wouldn't be quite eligible for our program. We have a few others that you may be eligible for, but not the HOPE program. It would have to be something, I would say, naturally occurring, not induced by substance use.
Okay, so that is helpful to know. So that does seem like if I was using a substance and I started having those, a better fit for me might be the substance use program, not the HOPE program.
Correct. That's a perfect example of another program that would help. Yes.
Okay. So thinking about the HOPE program, what exactly does it do for clients?
So let's say you are joining the HOPE program and you come into the program. We provide a ton of services. In the program, you would get medication management, where you'd be able to see a doctor, nurse practitioner to review your medications, to prescribe medications. You get supported employment and supported education with our CEAS. And our CEAS is just a supported education, supported employment specialist, where they can help you with job placement and job prep, get you connected to local temp agencies, all of those things that get you on a job, get you stable in employment. With supported education, we offer up to $2,000 per semester of tuition assistance, where that $2,000 can be used towards your tuition, books, materials, all of those things that help you be successful in school. It does not have to be a typical higher education where you're going to a university. We can
Mhm.
assist you in trade programs, vocational programs, certification programs, all of those things. So it does not necessarily have to be college or junior college. There, as long as it falls within education, we can assist you with it. We also assist with supported housing. If you are to come into the program and become stable in employment, we would do a budget with you and help you find housing. And many times we are able to assist with the first month of rent and deposit. So that's a great leg up for a lot of people to
Yeah.
become stabilized. We have therapy. In the program, you would get at least one therapy session monthly. You can get more if you like, but we do guarantee at least one therapy session. We also have peer support in our program. We have a peer support specialist, and we also have a family partner in our program as well. Those two roles are being filled right now, but once they are eventually filled, we will offer those services as well.
Wow. I'm just thinking about everything that comes with this, and I
Mhm.
can't think of many other programs that are as all encompassing as that.
Mhm.
We've got education assistance, employment
Mhm.
assistance, a little bit of housing assistance,
Mhm.
peer support. You've got someone who can come in and work with the families, counseling. Um, that is amazing.
Yes, all around.
And it sounds like my understanding of this program is the goal or the motto or the thinking behind it is early intervention. So
Yes.
catching folks that are very early in their experience of psychosis and trying to give them resources so that they don't follow what a lot of times we think of the typical deteriorating progression.
Yes, that is exactly the goal of the program when it came about. The grant for this program is grant funded, so you can participate in the program. If you have insurance, or even if you don't have insurance, you can come in and still get all of these services at no fee. It was brought about because they found with studies that people who experience psychosis between the ages of 15 and 30 for the first time, if
Mm-hmm.
they're able to get that assistance and avoid repeated hospitalizations, there's usually a better life outcome as far as employment, education,
Yeah.
and just general life quality. If you're not getting caught, I would say, somewhat in that cycle of being hospitalized, experiencing homelessness, all of those things.
Mm-hmm. Absolutely. The things that we would like to, as a
Mhm.
society in our slice of life in East Texas, try to reduce. And you
Mhm.
kind of spoke to one of my next questions, thinking about if I want to be in the program, how do I pay for it? And it sounds like
Mhm.
I, as the client, don't really have to worry about that. If I
No,
have
no.
insurance, great. But if I don't, that's
Mhm.
okay too.
Correct. And even with medication, people say, well, that's great. How do I pay for the medication? Because as we all know, medication can be very expensive as well. We can assist with medication at the Andrew Center. We have a patient assistance program where if you are
Mm-hmm.
needing assistance, we would first sign you up for it to see if you're eligible for that program. Most people are. If any reason you're not eligible for that program, the HOPE program itself can assist you in supplementing and helping pay for your medication. So even down to medication, we have you covered.
Wow, that is amazing.
Mhm.
I guess a few more questions. If I am just a regular Andrew Center client or someone out in the community that isn't a center client,
Mhm.
how do I get involved in this program if I think that this is the right fit for me?
So there's a few ways. If you're already involved in the Andrew Center, the quickest way to get to us is to speak with your case manager, your doctor, your nurse practitioner, and tell them, hey, I heard about the HOPE program. I'd be interested in enrolling. They would send a internal referral to us. We give you a call, make sure you're eligible, and we're usually able to bring you in the program within 7 business days. So we're able to get you in very fast. If you're out in the community and you're not already connected to the HOPE program, Our contact information is listed at andrewcenter.com. And you can also send me an email directly at hope@andrewcenter.com. And that's all one word, no spaces or dots there. Hope, HOPE @andrewcenter.com. You can contact me directly. I monitor that email, and I'd be happy to speak with you about the program and assist you in coming into the program, getting an intake done, and getting you routed to us. So either way, if you're already involved or you're in the community, feel free to reach out to me to that email address as well, and I can always assist you with giving you more information about the program and getting you enrolled.
Absolutely. And again, you answered another question I had. So it sounds like the wait time, if I'm a good fit and I can, if I can be eligible for that program, less than 7 days. That is, again, amazing considering what it is that you're offering.
Yes, with bringing you into the program, you're usually able to meet with me. I would be doing some of the introductory paperwork for the program. I'm usually able to meet with you within 7 business days. Once you've met with me, you start your appointments with the other portions of the program, the therapy, the peer support, your first doctor's appointment, all of those things. Usually those things happen, I would say, within 2 to 4 weeks, the next process. So it's all pretty fast. From 7 days of seeing me, and over the next 2 to 4 weeks, you'd have appointments for therapy, medication management, peer support, all of those good things. So within a matter of 4 weeks, 2 to 4 weeks, you'll be fully enrolled and moving, getting your services, getting your medication, all of those things.
That is wonderful. That is absolutely rapid early intervention. I guess kind of the last question that's coming to.
Okay. Go ahead. I was just going to say, I'll just note that I believe that is probably the fastest turnaround as far as coming into the Andrew Center, of being able to get into services, see a therapist, see a doctor that fast. So if interested, we're definitely able to get you in very fast. I think we're probably the fastest program to get in right now.
It sounds like it. The last question that I was thinking of is, say I'm new to your program, how long am I going to stay in it? How long can I get these benefits?
Our program gives an initial 24 months, so 2 years initially in the program. Once you get to the end of your 2 years with us, we'll do an evaluation with our staff to see if we recommend you for a 3rd year. Many clients do get a 3rd year. For example, if we have people who are in college who are still needing assistance and they're doing well in the program, we would grant a 3rd year. If you're needing additional support as far as therapy goals, medication management goals, those supports, we can grant you a 3rd year as well. So the initial, I would say 2 years, but we can grant a 3rd one. After that 3rd one, we would have no choice but to discharge you into the community. When that time comes, we can discharge you to a program within the Andrew Center, and we can also do external referrals. So we wouldn't leave you hanging. We definitely make sure we connect you with another provider that would be able to give you services similar to ours, or at least our base services, I would say.
So hopefully at the end of my 2 years or 3 years, I have the tools, the skills in my tool belt to not need such intensive services, and I can probably be okay with regular adult case management or an option out in the community.
Correct. That is the goal, is that when you get to the end of your 2nd or 3rd year, that you're not necessarily having to go to another intensive program. Usually our goal is, when our clients leave us, would be to go to a routine case management where they get the medication management. They'd be seeing the doctor once a month, once a quarter, whatever it may be, to get their refills, as well as having periodic check-ins with the case manager and things of that sort. Just basic services, basic upkeep, I would say.
Yeah. Okay. Dominique, this feels like we're at the end of things. Do you have anything else you want to add to this?
No questions or nothing I necessarily want to add. I'll just throw the email out there again. If you'd like to contact me or learn more about the whole program, feel free to visit andrewcenter.com. Our program is listed under services as the Hope program. It also lists my contact information, which is hope@andrewcenter.com. You can also reach me at dguthrie @andrewcenter.com, or you can always give me a call at my office at 903-597-1351. My extension is 7377. So if you call the Andrew Center and you're trying to reach me, that extension is 7377, and I would be happy to speak with you.
Perfect. That's wonderful. Thank you so much, Dominique, for your time and letting me and other staff members and people in the community know a bit about this really amazing program that maybe not a lot of people know about. So thank you so much. You have a great day.
You too. Thank you. Have a great day.